As you can tell, this is my friend Dr. Eric Thomas Johnson, and he's giving the chakra sign. He is a very, very dear friend of mine from Honolulu. Eric was diagnosed in 2010 with cancer of the large intestine, and during that time it progressed into other problems for him, prostate cancer, bladder cancer, coronary heart disease. And Eric, how do you feel today, sir?
No, much better.
Well,
like pre-operation days.
It's good to know. Eric has a very wonderful family, and I had the opportunity of spending 20 days with them, and it was the best 20 days I've had so far. Now, Eric was on Dilantin and warfarin for how long, sir?
Probably 3 years, at least 3 years.
And what were your symptoms during that time?
Well, it was just, I had the fibrillation, probably 160 beats per minute, and went to the hospital, and at that point they determined that I should take the warfarin.
Now, how do you feel that now that you're completely off it?
Well, I feel a lot better physically, and I don't think I'm as angry or as stupid as before.
No,
So
you
I
were stupid.
Things. Well, yes, but when you sit there and you have to say, wait a minute, to get somebody's name or something else.
Yep.
It's a little...
Now I should let you folks know that Dr. Johnson is a sociologist. He's brilliant. He did a lot of the housing projects in Thailand, and when he came to America, he had American medical care, and now he's actually eating a little bit better, sort of. But why don't we talk about the squamous cell carcinomas, and how did the medical doctors treat you with that, sir?
Well, in the beginning, my regular doctor, the GP, he said, "Oh, it's nothing, forget it." And then it got quite large, and I decided to go see a dermatologist in Grand Rapids, which they cut it out and went through some fancy stitching to make this scar not look good. But after a few days at home, it started coming up, so I pressed on it, and black blood came out and red blood, and so I just started putting hot water on it for a while. That didn't seem to help, and then I got another one on the other side. So by the time Dr. Hines got here, I had those problems also.
And what did they call all your problems, Eric? Your skin. What did they call your skin problems?
I don't know. What do you mean by that?
What did they call you? What did they call it, sir?
Well, they just, it wasn't the carcinoma that was a virus that had all these little white spots all over. They said that was the old man's disease.
And his old man's disease turned out to be a molluscum contagiosum, which most of us know as warts. And usually it occurs with people who have a lesser immune system or small children. But Eric, how do you feel today, and what are you going to say about the program?
A very good program.
How do you
recommend it? I feel much better, a lot more confident.
And to let you know that I also cut hair. Anyway.
You don't have anything to worry about.
Anyway, it's been a pleasure treating you, Dr. Johnson. Thank you so much.
Thank you.
Good health. Aloha.
Thank you. Aloha.